Hello, my name's Kath Barton. I'm a paediatric physiotherapist that's helped set up a charity, Appropriate Paper-Based Technology for Social Development. As a quick introduction, the first few slides give a summary of what our charity is about and describes a sustainable seating and standing solution for children with disabilities using appropriate paper-based technology. Cerebral palsy is the most common cause of physical disability in children worldwide, with a lifelong impact. Around 40% of children with cerebral palsy are non-ambulant with a severe impairment and are not able to sustain a sitting or standing posture. So, cerebral palsy affects about 1 in 500 births worldwide. It is the most common children's disability. It is more prevalent in low-middle income countries. It primarily affects posture and movement. It is caused by early brain damage, and the severity is dependent on the degree of brain damage. Often it is accompanied by epilepsy, sensory and learning difficulties. More severe cases prevent sustainable sitting and standing postures. Postural support devices like adaptive seating and standing frames are provided routinely for these children as part of standard medical care in the UK and other high-income countries. They are used to improve postural control, enhance function, and prevent deformity and fractures. In resource-poor settings, these devices can make a significant difference for children with severe disabilities and their families. These children are unable to sit alone and spend most of their time either carried by a caregiver or lying down, usually on a mat or mattress indoors. Sitting up is essential for developing interaction and communication with others, as well as eating for safe swallowing. Lying down indoors means that children are unable to participate in the life of the household and can easily be ignored. Carrying the children places a heavy physical strain on caregivers and makes it difficult to take the children out of the house or to go to the clinic or to market, for instance. This further increases the children's isolation. Assistive devices can make a significant difference for children and families, and local design manufacturers are key to ensure that they are effective and affordable. In many developing countries, children with disabilities cannot access suitable, affordable seats or standing frames to promote their development and participation. A low-cost, sustainable solution for suitable postural supports is needed. Local design, manufacture and repair are key to ensure the seating and standing devices are appropriate, effective and affordable. One solution is the use of appropriate paper-based technology, known as APT, to make chairs and standing frames cheaply and locally and adapt them to the needs of the individual child. APT is a way of making useful items from recycled materials, including cardboard and newspaper, using simple tools and flour-based glue. Training people to make APT assistive devices is straightforward, and workshops can be established for sustainability. More courses on constructing APT devices alongside the training of rehabilitation workers on the management of postural support are needed to reach the large number of disabled children and their families living in resource-poor countries. The presentation now is about postural care and positioning of the complex child. This presentation objectives are firstly to understand the importance of good positioning and postural care, to be able to position children with complex disabilities well and to be able to show others, to understand the potential health complications caused by poor postural care, and to be able to understand ways to help children move and be able to explain to others how they can do this. What is postural care? Postural care is about protecting a person's body shape over the course of 24 hours by using a combination of good positioning, handling techniques, active movement, and the right equipment. With understanding about the skeletal system and what happens to the internal organs as the body starts to change shape, emphasis can be made regarding the importance of postural care for everyone who is supporting the child and family. So if we understand why some postures are destructive, we can try and avoid them by using positioning equipment such as cushions, rolls, specialist seating, sleep systems, standing frames, splints to help the child be in a more supported and symmetrical position. Muscle contractures are common in this group of children and can be reduced by the implementation of gentle stretching of the muscles and soft tissues. This can be done by positioning during sleep. Muscles are relaxed. Promotion of normal postures and movement by handling and therapy, and the use of splints and assistive aids. A postural management programme. This is a planned approach encompassing all activities and interventions which impact on an individual's posture and function. Programmes are tailored specifically for each child and may include special seating, nighttime support, standing supports, active exercise, orthotics, surgical interventions, and individual therapy sessions. This definition is from a consensus statement on postural management for children with cerebral palsy that therapists in the UK use. And postural management can be seen to be a key in our role as therapists working with children with complex disabilities. Postural management therefore aims to promote the motor development and function of the child, to promote their comfort and ability to sustain positions through stability and symmetry, to maintain muscle length and joint integrity, to try to prevent deformities and contractures, and to promote well-being. So what are contractures and deformities? A contracture is when there is adaptation and shortening of the connective tissue of the body, which can cause joint stiffness and pain. Connective tissues include muscles, tendons, musculus tendinous junctions, ligaments, fascia. So all these structures require movement to maintain their length and function. So contractures can occur either in joint capsules as well as in muscles. In cerebral palsy, there is both soft tissue tightening, there's the non-neural component, and then there's the neural component caused by the abnormality of tone. Deformities. Bony deformities can develop if you're spending too long in one position. The spine can become permanently crooked and twisted, and the hips can move out of place or dislocate. Who is at risk of developing contractures and deformities? People who are unable to move and unable to maintain symmetrical postures are at risk. Spending long periods of time in limited positions can cause body shape distortion. So people with cerebral palsy have abnormal tone. So those with high tone can be pulled into asymmetrical postures, and their tone prevents a variety of movement. And those with low tone can be pulled into asymmetrical postures due to the force of gravity. Many children with disabilities cannot maintain their own posture, and without support can develop deformities. These deformities take the form of the habitual positions the child adopts and worsen as the child grows. In addition, the child's inability to move means that they need to be given regular changes of position. Postural problems in cerebral palsy are therefore caused by the abnormal muscle tone, limited movement and poor positioning. Low or high tone can influence the position of the body. The combination of abnormality of tone and limited movement patterns causes the child to be in poor or destructive postures for long periods of time if they are not corrected by good positioning and specialist equipment. High tone, or spasticity as we know it, can lead to a reduced base of support, so resting positions are not as supportive at points of high pressure, and the tone pulls the body into these abnormal positions, which can cause asymmetry, with the patient working hard against gravity to maintain their balance inside their base of support. Whereas the children with low tone, they take up the supporting surface, so their legs may be frogged and the ankles plantar flexed. Bony deformities that can develop are spinal curvatures, a scoliosis, which is a lateral curvature of the spine. This leads to squashing of and internal pressure on the internal organs, such as the lungs and the bowels. A scoliosis can be serious. It leads to bony deformities of the chest wall and can lead to restrictive lung function, meaning parts of the lungs are compressed and the respiratory muscles operate inefficiently, so the client will have a difficulty in breathing and a greater susceptibility to chest infections. Ultimately, this could lead to premature death. Typical hip and pelvic deformities that develop are wind sweeping of the hips, which is associated with hip dislocation. The asymmetrical posture is destructive. Hips are rotated in different ways. One turns in and one turns out. The trunk and spine compensate, causing a spinal scoliosis. Pain around the hip joint or reduced range of movement of the hip, especially a lack of the abduction movement, can be an indication of hip problems and needs further investigation. The children that are at risk of hip dislocation are those children who show persistent asymmetry or adopt preferred asymmetrical positions and have not achieved symmetry at the age of 3 to 4 months. Children with bilateral cerebral palsy, where there is increased tone or spasticity around the hip joint, especially in the adductor, iliopsoas and hamstring muscles, with increased tightness and shortening of these muscles. And children who have not gained enough head and trunk control to sit independently by 2 years, and children who do not walk independently by 5 years. How tone influences balancing and postural care. For balance and stability, you need to consider the ability to resist the force of gravity, what the centre of gravity is, and what the base of support is. When there's abnormal tone, often the child will attempt to stabilise. This causes increased effort, which in its own way has an effect on tone. So it's a bit of a circle. So if the patients are working to keep their centre of gravity inside their base of support, this can lead to fixing. So they can be gripping, holding on, pushing, pulling. This decreases the function and ability to enjoy meaningful occupation, as hands are not available for activities. So to help with this, if you use postural supports, this can reduce the need to balance, it can improve fatigue and help the child's function. An introduction to positioning. Positions build a base for movement. and good positions are needed for eating and drinking, communication, play, and activities that we do every day. The key to supporting a family with a complex child is building a foundation of good positions for them to use, and then from these positions, helping their child to move. I want to emphasise the relationship between good positioning and helping children to develop and protecting them as they grow. By learning about good positions, the children will learn new skills. Poor handling and positioning will slow a child's development. It will make it more difficult for the family to pick up, carry and handle their child every day, and can cause problems that we've talked about already, such as contractures and deformities, but also pressure areas. Pressure areas, when you're leaning or lying on a body part for too long, you can stop the blood from flowing through the muscles and cause painful sores. These begin as dark red or purple areas and can take a long time to heal. As we've said before, children with limited movement patterns are more prone to joint contractures, and development of contractures tend to occur around growth spurts. Poor positions can lead to destructive postures. Usually these are caused by asymmetrical hip position. Hips are rotated in different ways. One turns in, one turns out, and this leads to pelvic asymmetry. When you're looking at the position of the pelvis and the hips, it's three-dimensional. So you would look at the pelvis, its anterior and posterior tilt, its obliquity, whether it's lifted up or down, or whether it's rotating, coming forwards or backwards. This sitting, the windswept sitting position, if it becomes habitual, it will lead to discomfort in joints and can lead to deformities such as your spinal scoliosis and hip dislocation. Good handling of position and positioning. This influences what a child can do and how a child can develop. It helps to make eating and drinking, playing and communicating easier and safer. It can make it easier for families to care for their child. It is the basis for all activities that families do with their child. It helps to prevent disabling positions that lead to deformities. It should always be taught on an individual basis to each family with a complex child, as each child is individual and has their own needs, and should be used with each child all the time. Principles of good positioning. The idea is to reproduce postures adopted by typically developing children in terms of load bearing, joint position, symmetry, and function. Positioning aims to provide a symmetrical, stable position and which can be used as a base of support for movement, so for function and activity. And children should always experience a variety of positions throughout the day. How to position your child. Correct and appropriate positioning will vary from child to child, depending on their condition. It's dependent on their age as well. Not all positions are helpful for all children. So you need to learn what works for each child. If a child is stiff, then it's useful to move them and loosen them. And good to teach the family how to do this. So you're teaching the family to help move their child and to try to get the child into the best position that you can. So you're aiming for ideal positions. The child may not be comfortable in a new position straight away, You may need to initially limit the amount of time she is in that new position and gradually increase the length of time as her tolerance increases. But to remember to change the child's position regularly, about every hour. Encourage her or help her to change her position herself. Remember, if you leave a child in one position for many hours, she may develop pressure sores and her body may gradually stiffen into that position, which will increase her disability. She needs to be placed in a variety of helpful positions throughout the day. Position 1, lying on her back. This provides the body with the most support and the least amount of balancing. This can be a good position for resting in, but it does not help a child develop control over her body movements and learn ways that they can move their body and head as compared to being in other positions. And the older your child gets, the less time they should spend on their back when they are awake, as it's not a very functional position. Lying on the back. This is obviously a poor position. The head is pushing back and turned to one side. The child is quite asymmetrical. The hips are turning in, causing the legs to cross and scissor. The feet are pointing down, means the child can't get them flat if she is sitting. Hands and arms are away from the body, so not in a useful position, and the hands are fisted. This is a better position for lying on the back. This can be a good position for resting, although it does not allow the child to engage with other activities. So what you can see is the head is in the middle here. It is supported. The arms are brought forwards by these rolls so that the hands and arms can be more use. The knees are bent to come away from often increased tone around the hips that causes the hips to extend. So the child is not able to push back and cross the leg into a scissor position. So it's a nice symmetrical position where the base of support is in the middle. So this mum here is just trying to get this child into a more symmetrical position. Lying in a hammock can help to relax tight muscles for smaller children. Babies and small children can hang in a large towel held by two adults to try and relax tight muscles. And these are the muscles that are pushing back into extension. When they're pushing back, when the children are those that are going back into extended postures. Position 2, lying on the front or tummy. Lying on the tummy is really important for developing strength in the head, neck and back. Children learn to roll, crawl and move by spending time on their front and then being encouraged to push up through their arms. Often children don't like being on their front when they are not used to it, so they start with small amounts of time, build up slowly to longer periods. Sometimes a small rolled towel under your child's chest or shoulders and positioned around her on either side can help her to hold this front propped position for a longer time. Try and play with your child while she's on her front to help distract her. So lying on the tummy, here you can see this is a poor position. This child here is unable to lift his head. His hands are caught underneath him. He's not in a functional position. He's asymmetrical again. So lying on the front on blankets may help. So this child, well, this shows the position really. So they're lying, so putting some weight through the arms here. This child has to have some amount of head extension, head control to lift the head up, to look ahead. Weight bearing through the arm for play here. Now this is a simulation of this position, which is a nice position, and it's a position we're working on trying to get the baby's head control, so to get it stronger really, and the upper back a bit stronger, because that's usually where you start to get your control over your head and trunk. It starts at the top and works down. So this is a nice position. And you can see at the bottom, again, the feet aren't pointing backwards, they're dangling down. So you're not getting tightness in the calf muscles here, which can be a problem for sitting and standing later on. Lying on the side, position 3. This is an important position because it uses both flexion and extension. It uses a mixed pattern of movement and enables children to get their hands together for play. Often it is a comfortable position for children who are stiff. It allows children to get the hands together, which is essential for development and play. It is also very good for children who produce a lot of saliva, as it helps the saliva drain out of the mouth safely. So lying on the side, this is a nice position. I can roll up a towel or blanket behind or use a pillow. The head's on a pillow here to keep the head in midline. The arms are forward and we've got a toy or something here for them to hold. Here you actually want this hip at the knee at the same level as the hip. So you want quite a high support here. Here it looks like it's falling down a little bit. That's not such a good position for the hip. Here is a better position really. This is showing side lying as we like it really. So the head is in the middle here. He's looking over here, but perhaps you want to have something here for him to use to play. Here, head is in the middle, looking at this toy. Hands are here to start to explore. Seated positions. Children will typically learn to sit between 6 to 9 months of age. If children have not developed sitting skills by then, it is important for them to be placed in this position. So sitting with a caregiver, sitting on a chair or alone. Sitting will help your child see more of the world around her and will help social interaction. Sitting can help protect her hips from problems in the future. Lying down all the time does not help the hips develop in the right position, and this can cause pain in the future. This slide shows some poor positioning. Sitting with a caregiver in this way is not best for the child. You can see that the head positions are not in the midline. They're either hanging back or to the side. So this is not very functional. The child can't see ahead of him to use his hands or to communicate with anybody. The arms tend to be hanging backwards, so they're not very functional, as in he's not able to then use his hands to do anything. The hips are not bent in any of these positions, so he's lying rather than sitting on his bottom. And the child often asymmetrical, leaning to the side. The legs are twisted, which can be harmful, and the feet are not supported. These are good positions. Sitting with the child, sitting with a carer. You can see that the head and body, if the head and body are in a much better position, if you cannot hold a head upright, make sure it's sitting up straight with a head and back supported. If you can hold a head upright, use your hands to support a chest and hips, just enough to help her stay up straight and control her head. She should be working her muscles to move her body and keep it upright. It's good to have the hips and knees at least at right angles. This will help keep her back in a good position and help her stop from pushing backwards and sliding off your lap. If possible, have feet supported. Shoulders and arms, have them slightly forward so that the arms and hands are in front of the child's body and she can explore objects and her own body. This first position shows a more active way of playing with a child in a good position. Sitting on a chair or buggy. In sitting, the child should be positioned to ensure that the pelvis is in a neutral to anterior pelvic tilt with no rotation or obliquity. So that means that the pelvis is symmetrical, basically. The buttocks are at the back of the seat. You can use a lap strap to prevent sliding down the chair. You want the thighs are horizontal with the hips, and the hips, knees and feet are bent at about 90 degrees. You want the child to be sitting upright with a straight back and head. You want the shoulders to be slightly forward so that the arms and hands are in front of the body, making it easier for the child to use her hands to play and explore. This slide shows good positions of one child in a wheelchair and one child on a chair. These children are sat upright with their backs straight and their head almost in the middle. Their bottoms are at the back of the seats, and when there is a lap strap, you need to make sure that it is tightened firmly enough to stop the child sliding forwards on the chair. The legs are nicely supported and the feet also. And the arms are in front of the child so she can use them for play or feeding or whatever. This slide shows sitting on the floor, some paw positions. This position here, the first one, we call this W sitting. It's kind of kneeling. It's not best because you don't need a lot of control to be in this position. You have a stable base of support, centre of gravity down here, but the legs are in a poor position really. It's good for the child because he can balance in this position, but he might not be able to develop balance for sitting in other positions if he's always in this position. And it can damage the knees and hips. If it's the only way a child can sit independently, then it should be done safely, but not too regularly. And then sitting with the carer here, this is a poor position because this poor child has got his head to the side, so he's not able to get his head in the midline for communication, which is so important. These are good positions. So you can use a variety of things around the house really. So here you've got a washing up bowl that's got cushions around it, and this child is wrapped up here so trunks control. So it's a really good position for this child to learn head control, to have the hands forward and develop some control with their hands and fine motor skills. Here again, this is a nice position. The head's in the middle, the trunk is straight, the arms are forwards, the legs are out to the side. This is a form of corner seat really, both these are, and again, these are nice positions, giving a stable base of support and enabling the child to use their hands for playing or other activities. Cross-leg sitting, as in the first picture, is a good position for a child. This gives him a stable base of support. The head and trunk are straight, so the arms are forward, so the child can use his hands for play and gives good eye contact for communication. The one issue to be aware of is that a child shouldn't always sit in this position because his knees are bent and this could lead to contractures. So you're wanting the child to also sit with his legs out straight at times to stretch the hamstrings. This is seen in the second picture. This little girl has her legs out in front. Again, she's in a good position, has a stable base, can give good eye contact and can play using her hands. Many children with disabilities spend their time sitting or lying. Standing is part of normal development and everyday life. There are many benefits to standing. Not only are there physical benefits to standing, but standing offers broader stimulation for the child, allowing them to interact with their family and peers at the same eye level. So standing can help with their social and communication skills. Standing allows them to see the world from a different position, which can help with their learning and thinking skills too. Standing benefits. A child who never stands has weaker, less dense bones that can more easily break. Standing assists in the development and strengthening of the hip joint and in preventing the development of contractures in the leg joints, helping to maintain their leg joint ranges of movement. Weight bearing through their legs can help reduce stiffness and uncontrolled movements, so reducing the tone. If a child never stands, their hips do not develop well, they can become weak and they can easily dislocate as she gets older, causing pain and other problems. Standing is also helpful because of the positioning of the internal organs, so it can help for reflux management, also can help in assisting breathing as the diaphragm has more space to move and can help with blood circulation. It is helpful for assisting in the emptying of both the bladder and the bowels. Development of the hip joint and dislocation. In the newborn, structure of both hip and shoulder joints are not the ball and socket joints as we know them. The socket is a shallow curve and the ball is a flattened head at the end of the femur and the humerus. It is only by weight bearing that these two joints fully develop, so through crawling and walking. If the child does not weight bear, then the joint remains relatively shallow and may be subject to the distorted pull of adjoining muscle groups or gravity. The hip may dislocate, which can be both painful and cause suffering. However, hip dislocation at a very early age, such as in the newborn, does not usually present with pain, as the soft tissues around the joint, the capsule, tendons, ligaments, stretch with the dislocated hip. But when there is a subluxation or dislocation at a later stage in a child's life, then this often causes pain and discomfort. Types of dislocation. Children that have spasticity and dystonia tend to have posterior dislocations. So the hip, the head of the femur goes backwards, and children with low tone, hypertonia, tend to have anterior dislocations. And as I said, the importance of this is that it can be painful and causes suffering, and the position onto which it dislocates may cause further problems later on. So a high dislocation of the hip may cause problems in separating the legs for personal care. And in these instances, surgery may be considered, and this is a major cause of a loss of quality of life. Standing. This picture shows a child in a poor position. She has stiff leg muscles, one or both legs, so she can't stand on flat feet easily with her knees and hips straight. Her balance isn't good enough to let go, to do something with one or both hands. She has to hold on for support. All she can do is stand there with her hips and knees bent. A good standing position is when a child stands with vertical thigh bones and flat feet. The knees are slightly bent and soft, but are able to straighten. The pelvis is symmetrical. The shoulders are slightly forwards, and if there are slight movements in an aligned standing position, this helps promote hip development. It is recommended that children should stand for an hour 4 or 5 times a week in order to enhance bone and joint development. These are good standing positions. As you can see in the first picture, this is just a simple piece of wood. The balance is not difficult in this position. Her hips and knees are in a good position, helping to keep her feet flat. Her shoulders and arms are forward, so she no longer needs to hold on for support, so she can use her hands because they're free to do something. And look, she is happy. Look at her smile. Standing with support. As you can see from these two photos, these are good positions for these children. The first child is in a standing frame, and the second child is being supported in standing by her carer. What I like is that the head and body are in good positions. The back is straight, the head is in midline, so there can be good eye contact. In the standing frame, if the child is leaning to the left or to the right, you can put a rolled up towel on either side of her to keep her body straight. You want hips to face the front, and you can adjust this slightly if necessary by moving her hips. Her legs and feet, her feet are firmly on the ground, including her heels. Her toes are facing forwards and her feet are not falling in or out. So foot position is important. If you can easily move her feet, she is not putting enough weight on them. So I would then loosen the frame and let her take more weight through her feet before easing her back into the frame. Always recheck hips and feet position. Picking up a child. It's important to teach the family good habits. Here you can see the two pictures. It is the second picture that is showing the mother picking up her child in a good way. You want to bend your knees, keep your back straight, and lift using the muscles in your legs and not your back. This will protect your back from injury. It can be easier to pick your child up with one foot slightly in front of the other for balance. Always turn your child towards you, then lift and hold her close to your body before standing up. If your child becomes too heavy for you to lift alone, ask someone to help you. If lifting with another person, count before lifting so that you both lift at the same time. This is important to keep your back from injury. Carrying a child. As you can see, these two photos show poor positions. In the first photo, it shows the child with the head falling back, not able to see, body is stiff and straight, and her arms and hands can't do anything. In the second photo, you can see the child is scared, is fearful in this position, does not feel supportive. These pictures show good positions for holding and carrying a child. A more upright position will help a child hold their head up and look around, so helping with head control. Even if a child can only do it for a short period, it is good to allow this. Legs and feet, use positions that help the hips and knees be partially bent and the knees separate. It's good if you can hold on with if the child can hold on with her arms or she can free her arms for playing. These are good positions. Remember, empower families. Give advice on how each child can benefit from positioning and activities and what families can do on a day-to-day basis. It is not possible to always attend to a child, so families need to be taught safe and supported positions that a child can be left in when necessary. Encourage families to guide their child into helpful positions. Encourage and show families different positions to see what works best for their child. Good positioning helps make daily activities easier for these children. If you can supply relevant supportive equipment like buggies, APT chairs, APT standing frames, positioners or wheelchairs, this will help. Supportive equipment can improve a child's quality of life. Many children with disabilities cannot maintain their own posture and without support can develop deformities. These deformities take the form of the habitual positions the child adopts and worsen as the child grows. In addition, the child's inability to move means that they need to be given regular changes of position. APT equipment helps to achieve this and to maintain the child in a symmetrical position where possible. This protects them from deformity and enhances function, as can be seen in these photos. So the benefits of postural care, remember, it's about protection of body shape for these children, prevention of deformity, avoidance of corrective surgery caused by distortion of body shape, avoidance of secondary complications, avoiding pain and distress for the person involved, the health gain for the individual as well as improved quality of life for them and their family. Any questions?